The rains are back, and with it, so are the army of mosquitoes with more bite. Dengue has been on the rise, and this season seems no different from the past in Bangalore. What are the symptoms to watch out for? One might experience fever, body pain, and chills, which is the initial part of the infection. While this can subside for many, its severe form includes persistent fever, vomiting, and low platelet count, all of which are dangerous signs. Other signs are rashes and bleeding over the feet, hands, and legs. Among women, heavy flow during periods or menorrhagia, breathlessness, distension of abdomen, and state of shock are some of the other symptoms.
It's persistent, they are very weak, and if they find red spots, it is better to come to the doctor. Not to be neglected, because if they come too late, then they go for multi-organ failure and sometimes death also, which is dangerous.
Youth and middle-aged people are most prone to dengue.
Preventing measures are see that they are ideally not exposed to the mosquito bites, to wear full clothes. First is to use mosquito repellents, but use properly and cautiously so they are not intoxicated with the repellents, and preferably a mosquito nets at home. It could be for the window nets or it could be the sleeping nets, which will help getting bitten by mosquitoes, and avoid daytime mosquito bites also, which is most important.
Some do's that we can adhere to prevent this. If you have fever, avoid certain drugs like aspirin, NSAIDs like ibuprofen, diclofenac, because these decrease the platelets that would lead to bleeding or shock. Fever of a mild degree can be treated at home with adequate hydration. It is recommended that one take B complex so blood and platelets improve. Do not neglect high fever, bleeding, etc. One must go to the doctor immediately if fever persists and there is unusual bleeding in the nose and gums, which are common symptoms. The normal platelet count taken by labs is 1,50,000, and in case of a lesser number, one must brush their teeth with the fingers. Would that?
See, yes. The books doesn't tell that it is being contacted with the close contacts, but what we have seen is, if a patient develops dengue, we have seen the whole family sometimes coming. Okay, so sometimes the initial part of the fever can be transmitted also, I suppose, but still it is not proven, because the whole family sometimes will be affected with dengue. If the fever is persisting more than 2 days, then if there is very high fever, do not neglect, because we see many patients even going for multi-organ failure. That is the failure of the kidneys because they go for hypovolemic shock. So recovery time and even death also. So to be prevented, they have to come early, take treatment early. Minimal treatment it is, at least with treatment with IV fluids, so that they don't go for dehydration, and monitoring for the platelets. So that is most important in this.